Let's talk psychoses for a little bit now. Psychosis is a major, it's a major emotional disorder that impairs the mental function of the affected individual so much that they simply cannot function in society. A hallmark condition of psychosis is a loss of contact with reality. Schizophrenia is one of the psychoses. And to be diagnosed with schizophrenia, you need to have 2 or more of the symptoms in a 1-month period. So delusions or false ideas. You know, you're the king of the world, and the person who believes that'd be a delusion. Hallucination, you are seeing or hearing things that you believe are there but are not there. Disorganized speech, grossly disorganized or catatonic behavior, and negative symptoms. And we'll talk about negative symptoms right now. Negative symptoms are things that are not there. So social withdrawal. I mean, no longer interacting with friends and relatives. Apathy. Just don't care what happens. The person's affects will be flat and blunted, meaning they don't smile, they don't get angry, they don't do anything. They don't speak much. There's a poverty of speech. Thought blocking. They just won't consider things. And catatonia. In a catatonic state is essentially total withdrawal into yourself, no interaction with the external environment at all, to the point of really no movement. Positive symptoms are things that are new and present. So, delusions, hallucinations, agitated, bizarre, and impulsive behavior, combativeness, disorganized speech. Now, the other one was lack of speech. This is disorganized and disordered thinking, whereas the other one is thought blocking. There's no thinking. Positive symptoms are overactivity in dopamine in parts of the brain. Negative symptoms are underactivity of dopamine in other parts of the brain. Negative symptoms have a slow onset, and there are changes that you can see on a CT scan. Positive symptoms come on fast. They have a normal CT scan. So we have 2 types of antipsychotics. We have the traditional or typical, and we have atypical. They also used to be classified as phenothiazines and non-phenothiazines. For both categories, duration of therapy is going to be a minimum of 1 year with the first episode of psychosis. Treatment may last for life. Low-dose maintenance therapy is usually effective to continue the effective treatment of the medication, but it must be continued. Need to be continued forever. All antipsychotic drugs should be slowly tapered and discontinued gradually over a period of several weeks. This may and if it's abruptly stopped, you may have cholinergic effects of drooling, diarrhea, and insomnia. Since 1990, they've been classified as typical or atypical. Antipsychotic agents stimulate or block the cholinergic, histaminic, nicotinic, and alpha and beta adrenergic neurotransmitter receptors to varying degrees. This is why all antipsychotic medications have a wide range of adverse reactions and side effects. So when we're giving antipsychotics, we always, of course, have to assess. And you want a baseline before beginning treatment, and then ongoing assessments to determine, is the medication working or not, and are there side effects or not. We'll want liver function studies, renal functions. We will assess for possible contraindications, assess for level of consciousness. And of course, when you're giving these medications, you need to make sure the patient actually swallows it. Some people will try to pocket them and get rid of them later on. So after they swallow, you'll need them to open up their mouth and look under their tongue to ensure that the tablets are swallowed. Traditional medications, Thorazine and Haldol on that list are the most commonly seen. If you ever are in the ER, Haldol's nickname is called vitamin H. Just so you know, that's just for, if you ever hear somebody order vitamin H, they're looking for Haldol. So why do we use traditional antipsychotics? Acute or chronic psychoses. And these treat positive symptoms of schizophrenia. So these treat the delusions, the hallucinations, the behaviors. They can also be used to treat intractable hiccups and nausea and vomiting. Remember, because of the anticholinergic and alpha-adrenergic blocking activities, these can affect that system and help control nausea, vomiting, and hiccups. It has it alters the effect of dopamine in the CNS. And there's just a diagram that shows the action of the anticholinergic drugs on the dopamine receptors. Now, of course, every medication has side effects. Always happens. So some of the side effects we need to assess for are extrapyramidal EPS, acute EPS symptoms, dystonia, akinesia, akathisia, bilateral fine tremors, and we'll be looking at some videos of those. Long-term EPS, tardive dyskinesia, which is like rolling the tongue, lip smacking, athetoid, choreic movements, and pelvic thrusting. You'll see these when you visit a long-term care facility that works with people that have psychotic conditions. African American males are at higher risk of developing tardive dyskinesia, and that usually occurs only after continuous long-term therapy. Neuroleptic malignant syndrome, NMS, is a rare idiosyncratic combination of both extrapyramidal symptoms, hyperthermia, and autonomic disturbances. Onset could be hours to months after the drug initiation, but once started, proceeds rapidly over 24 to 72 hours. It's most commonly associated with haloperidol, or Haldol, which is a long-acting flufenazine. See, even instructors sometimes have a hard time pronouncing medications. Okay. But it also occurs with other medications too. NMS is potentially fatal. Requires an intensive symptomatic treatment and immediate discontinuation of the neuroleptic treatment. There is no established treatment. Most patients who develop NMS will have the same problem if the drug is restarted. So we're going to treat them symptomatically and stop giving the medication, and hopefully their body will metabolize the medication out of their system. Now, when we're giving these medications, remember I listed a whole list of chemicals that these block, and each of the blocking, or each side effect of the blocking has a different. Let me try that one more time. Side effects that are caused by these blocking action. In dopamine, when you block dopamine, you get movement disorders, similar to like Parkinson's. Acetylcholine causes dry mouth and urinary retention. Histamine causes sedation and weight gain. Endocrine blocking actions can cause gynecomastia and sexual dysfunction. And adrenergic blocking will cause orthostatic hypotension. So we have a wide range of conditions to watch for when people are taking traditional antipsychotics. Some additional side effects: sleepiness and sedation, dry mouth and dry eyes, blurred vision, constipation, urinary retention, all those anticholinergic symptoms. Orthostatic hypotension is the adrenergic blocking. Could have agranulocytosis. We need to check a white blood count. And there could be weight gain. So those are some of the side effects and that we need to watch out for when we're administering and using traditional antipsychotics long term. Looking at thorazine and haldol, or chlorpromazine and haloperidol, as a comparison, thorazine has a low potency, low incidence of EPS, and a high incidence of sedation, anticholinergic, and cardiovascular effects. Haloperidol is highly potent, a high incidence of EPS conditions, but low incidence of the sedation, anticholinergic, and CV effects. They almost flip, well, they do, they flip-flop. So you'll give the medication based on what conditions you're treating and what side effects you want to avoid. Those are the traditional antipsychotics. Again, we will always watch out for extrapyramidal symptoms, and that we're trying, with traditional antipsychotics, we're trying to attack and address the positive symptoms of schizophrenia. Come back for the atypical.